My name is Dr. Rose M. I am a guidance and counseling consultant, and thank you for choosing to watch the Save Happy Life channel, where matters counseling, psychology, and teen parenting are discussed. Your support has been amazing. Keep subscribing, keep sharing, keep liking. I love you all. In our previous session, we looked at what dementia is, the types of dementia, and also cognitive and psychological signs and symptoms of dementia. Today we look at treatment of dementia, and we shall also look at taking care of a patient with dementia. We'll start looking at treatment, and I would like to encourage us that treatment of dementia depends on the kind of dementia, and a doctor may want to do a thorough investigation of the brain, do scans to establish if there is a physiological cause and treat the dementia accordingly. What is important to note is that dementia, or most types of dementia, have unfortunately no cure. However, doctors may prescribe drugs that make the patient comfortable and easy to manage for the caregivers. That is why I would like us to focus on taking care of a patient suffering from dementia, because this is where the actual work is. And I'm going to go through a few tips of how to take care of a patient with dementia. Remember, I shared yesterday or in the previous video that I have had close people close to me suffering from this degenerating disease called dementia. So I have the experience of taking care of patients firsthand, and that is why I'm passionate about care of a dementia patient, or care of a patient who is suffering from dementia. And these are the tips that I wish to share with you today. And number one, please, the first thing you do is get a proper diagnosis of the patient so that you know what you're dealing with. Is it a dementia that can be treated? What caused the dementia? Is it a dementia that possibly could be inherited? And how you go about now the next phase of the treating or managing the situation or the condition. Number two, education is power. Information is power. Read and read and read all you can about the disease so that you arm yourself with the information that you need to be able to go through this quite challenging, not very easy phase of taking care of a patient with dementia. Number three, accept the situation as is. This is the reality. If, for example, it is an inherited condition, there is nothing you can do about it. Nothing. You can only manage. So accept the situation as is. Do not think about magical cures. There is none. And people are going to mislead you and lead you to all manner of places and things telling you about cure this, cure that. Please accept the situation as is. That is the reality, that you have a lifelong patient to take care of. Number four, there being no cure, this becomes a stage in life where children parent the parents. You become a parent of your own parent. And the good book has laid it very, very clearly to us in Sirach, chapter 3, from verse 1 all the way to the end, and specifically verse 12 and 13. And I would like to read from some version that say, or that goes, My child, help your father in his old age. Do not grieve him as long as he lives. Even if his mind fails, take that. Even if his mind fails, be patient with him, because you have all your faculties. Despise him not. Even if his mind fails, be patient with him. That is the advice from the book written by Sirach in the Old Testament. There is where we are. That is our command. That is what we must do for our patients who are suffering from dementia. And many times they happen to be in the advanced age. More often than not, our parents. Number 5, there will be a long period of increasing financial demands. And it is an important factor that you budget accordingly. Start looking at it as a new financial obligation you have. Use the money that you have economically, because frequent visits to the high-end doctors, unless you can afford, may drain you rather early in the phase of taking care of this precious patient of yours. This is the time for African socialism, where family members pool their resources together to help this particular cause. Number 6, psychologically prepare for an increasing care time and in-depth care. Some patients get to a level where they have to be assisted with feeding, assisted with showering, assisted with toilet needs, and a 24-hour surveillance to protect them from self-harm. Number 7, strive always to keep the patient calm. As we mentioned in the previous video, they are easily agitated. So play along with them. If, for example, they are seeing non-existent things or people, just agree with them, because the same way your brain is not seeing those people or those things, it is the same way their brain is able to see those things. So arguing with them only annoys them. And more or less, when you are the younger one, when you are the child, it looks like you lacking respect and they really get agitated. If they refuse to eat or take shower, do not force them. Rather, take time. If cajoling does not work, if talking to them does not work, suspend the activity and reintroduce it after a while, because they will have forgotten and they will be cooperative. Number 8, if your patient is on medication, ensure that they take it, because some medications are like antidepressants, stabilize the patient's mood, and they make the patient pleasant to care for. They are less agitated, they are less annoyed, and their mood is stabilized. Number 9, one thing I can assure you is that you are unlikely, very, very unlikely to manage the patient alone. Get another person to relieve you so that you can also get a break. Manage your stress as the caregiver. Take walks to relieve the stress you may have accumulated over a day or two. Take time off to do something else. Make sure that you sleep sufficiently, eat well, and seek counseling if you feel there is need. Join a support group, an online group or a physical group. Number 10, do not focus, my dear friend, on the recovery of this patient, because recovery may never happen and it may frustrate you. It may make you get impatient. Rather, live one day at a time. And when you notice a downtrend in the patient, unless you can, it's something that you fail to do or something you can do about, do not worry. Accept and live one day at a time. Remember, this is brain degenerating. So with time, what the patient was able to do or what the patient has been doing degenerates. They lose the faculties. So you expect regression in the patient. Do not take it as your failure as a caregiver to give proper care. Number 11, allow the patient to do for themselves the things that they can do, and participate and include them in the activities that you feel they can still do or they are still able to do, so that they feel part of the family and they also enjoy that companionship in the family. Number 12, please, for Christ's sake, for heaven's sake, never ever lock these patients inside a room to prevent them from wandering. Rather, secure the compound. Ensure that there is always somebody to be around. Secure the compound in such a way that they will not have an exit to go out of the compound and wander away into the roads or into the village, because they need the walk around the home or the house, and they also need the sunshine. Number 13, prepare yourself and the rest of the family that the disease is degenerative. It is just a matter of time. And it does not mean that the care of quality is going down, but strive to give the best care. And at this juncture, prepare your children also, that if, for example, is their grandfather who is suffering from this, prepare them, enlighten them that grandpa is suffering from this. So when you go home and he asks you your name, please just say. And if he asks again, just say. Just to know that we no longer have the old grandfather that we used to have, who used to tell us stories, who used to know us by our names, but rather this is a different situation where he is sick and he may forget your name, he may forget the class, he may even forget who your mother or your father is. So prepare your children in that manner. Number 14, get proper diet for the patient. Let them eat less of the starch because they are not active physically. That will help them not to gain weight, and weight is never good for anybody. Give them sufficient protein and a lot of fruits and vegetables. They need that. You may ask your physician to recommend supplementations such as omega-3s, vitamins, minerals, etc., basically to improve their diet and their appetite as will be necessary. Number 15, keep an eye on the patient and look out for any arising health issue, because the patient themselves may not be able to express themselves. They may not realize that they are falling sick in this way or the other. If you visit a doctor, ask questions. Don't fear the doctor. Ask questions. Ask all possible questions. Ask possible side effects of any drugs that he may or she may prescribe, so that you are able to observe the patient and you understand the patient in terms of the side effects and any other arising complication. Number 16, shower the patient with love, compassion, and care. That's what they need most. Number 17, submit to the divine, the situation, your patient, the condition, for spiritual support, whoever you understand your divine is. You may wonder, can we prevent all these problems? Prevention of memory loss or dementia. Unfortunately, there is no foolproof way to prevent this. However, the following may help to delay or not to trigger the memory loss in a person. Number 1, manage stress. Stress can be a trigger to an underlying possibility of dementia. Number 2, eat well, eat a balanced diet with sufficient vitamins, omega-3, range of fatty acids, of oils. And number 3, sleep sufficiently. Number 4, keep your brain active. Read, solve crosswords, Sudoku, puzzles. Keep yourself busy with hard work. Solve mathematical problems mentally. I must say, this generation, the current generation of the of the calculators is highly disadvantaged, because for any little 1 + 1 they pull out a calculator. That is not good for the brain. Memorize verses, learn new songs. If you can, learn another language. Number 5, stop smoking. Number 6, exercise. Exercise at least 2 hours of physical activity of whatever nature daily. Number 8, get treatment for any underlying issues such as hypertension, diabetes, and any other problem that your body may be suffering from. And once more, shower the patient with love, shower the patient with compassion, shower the patient with care. If you need further support, please do not hesitate to reach out to me. I could be of help to you as an individual caregiver, to you as a family that has a patient suffering from dementia. Thank you for watching, and God bless you. Bye-bye.